One thing that you and your team do so well is setting expectations for folks with endo and as they're preparing for surgery. How can patients prepare for a successful surgery and like these expectation settings?
So when the patient comes in before surgery, we really talk a lot to them about what to expect after and prepping themselves up to surgery. So we could give them a handout or whatever about like what to get before surgery, but we want to make sure like pre-surgery that the patients are not experiencing constipation or straining on the toilet because when you're with post excision surgery, the last thing you want to be doing is straining or having bowel discomfort. That's like one of the number one things, right? Getting them squatty potties. They may need a sitz bath when it's safe to do that post surgery. So bowel management is super, super important. We talk about they might get shoulder pain from gas. So we're talking about things to alleviate that, whether it's a supplement, some exercise, moving around, things like that. We're talking to them about, well, we're working on the pelvic floor. So a lot of secondary pain to endo is pelvic floor uh, tightness and pelvic floor dysfunction. So we're working on their pelvic floor before surgery so that post surgery they have less pain, right? They might be getting injections, trigger point injections, Botox before, but we also talk about it post. So they may not be getting that before, and then they're getting their endo surgery, and then they might be getting trigger point or Botox injections later. But to really prep them post surgery, and I know Dr. Chu's office gives out like a little baggie of like all of their supplements and Colace and whatever else, slippers, socks, whatever. So we try to like go through, and Kara did like a reveal on our TikTok. It was funny about like all the little things post surgery. But so we go through all of that with the patients. But a lot of the expectation is sorry, my son is walking in the room. Please go in the other room. Post surgery, what we really talk about is when are they going back to work? A lot of patients are asking that. When are they going back to work? And some patients are, when can I try to have a baby too? So that's like the physician question. But so what we're doing, we're telling them like if you have a remote work job, 2 weeks, you could probably start doing the job remotely. If they have a physical job or they're going to the office, we always say 3 to 4 weeks going back to work, but also it is dependent on their physician too and what the surgeon. Some patients come into PT 2 weeks post, and depending on the surgeon, and some come in 4 weeks after. So I feel like I'm digressing, but yes,
And that's
that's
so helpful.
basically,
I
yeah.
know you've also shared just to help normalize you might feel not quite even healed or I'm not using the right terminology, but you might feel a little off even up to a year of this healing post surgery. Is that
Yes.
a good
Well,
expectation?
so we say for 6 months, your periods are still definitely going to be painful. If they may not be, but if they are, don't stress, because that is definitely normal. If there's not a hysterectomy involved, obviously. But I always say, and Kara can attest this too, at least a year before you really feel a lot of symptoms go away. And then I always say to them, sometimes you really feel bowel symptoms relieve first. That's like one of the first things. Um, so that's definitely an expectation we set for the patients.
It's so helpful, especially from a
Yeah.
mental standpoint to kind of
Because
know.
they're always asking right after, and it's super helpful that they know that before.
And this is where that multidisciplinary approach is that we in session can help decatastrophize, knowing that that's part of this evidence, right? That it could be 6 months to a year that certain things are still coming up for you.
Yeah.
Thank you so much,
And also
Erica.
another thing, just to note for the people listening, if you're having a lot of like abdominal soreness, we always tell patients you did too much that day. So you have to really like progress slowly
That's so
and
helpful.
monitor your
Pace.
own symptoms. Yeah.